We're going to present Dr. Lynne Feehan.
I'll begin by saying that my throat is a little scratchy today, so I'll do my best to try and get through this without coughing. So I appreciate, first and foremost, this opportunity. Thank you very much for this opportunity to come and speak to you today about the research that I did as part of my postdoctoral fellowship through the Arthritis Research Center. In keeping with today's theme, which is joint involvement, I think one of the most important things to remember is research, as in all things in life, is never done by one individual. And certainly this has been joint works and joint involvement by many, many people. And I'd like to just acknowledge two key people or joint involvement with this. Of course, first is Dr. Linda Lee, who was my supervisor for this postdoctoral adventure that I went through recently. And she was a co-supervisor along with Dr. Heather McKay from the Center of Hip Health and Research. And then also equally important, not just to my research, but to all the research in the Arthritis Research Center, is this partnership that we have with the Arthritis Patient Advisory Board. And I'd like to acknowledge, most importantly, from that perspective, Gordon Whitehead, who was the first consumer, I'm still stuck on the consumer, sorry, a sponsor for this research. And in fact, it was Gordon who came up with the name of the study, Well in Hand, which was looking at bone health in hands in people with early arthritis. And then also keeping with the theme of today is this joint involvements, is that as we all know, and certainly in rheumatoid arthritis, there's many, many joints that are involved, but most commonly the hands and feet are the joints, the areas of the body that are the most affected. And this is kind of the area that I looked at in my study, and so just for the title of today's talk, I'll be really looking at examining hand bone health and exploring moving feet and early arthritis. So why was it that I, as a physiotherapist, and a mature one at that, coming into research, wanted to look at this study? And so looking at inflammatory arthritis, and specifically rheumatoid arthritis, despite these really marked improvements in the sort of the management of the inflammatory joint symptoms in rheumatoid arthritis, people living with rheumatoid arthritis are still at 2 times the risk of having a broken bone than their age and gender matched peers. And so the question from my perspective is, the problem really is that current imaging like X-rays and MRI and some of the bone scans really can't pick up early changes in bone that's happening until the permanent damage has already occurred and it's too late. And the other issue, looking at it from a physio's perspective again, is that despite the many health benefits that we all know of being physically active, not just in terms of improving our bone health, but our joint health and our muscle health and our brain health and many, many benefits to being activity, people with, living with rheumatoid arthritis, again, report markedly less activity than those people that their age and gender matched peers that aren't living with rheumatoid arthritis. And again, from sort of a research perspective, that it's really difficult for us to really accurately measure the behaviors, the kinds of things that are different in someone living with rheumatoid arthritis. Why are they not as active? What kinds of things are they doing differently? And because that's the sort of thing as clinicians we can support. We can support behavior change. And that's really what we're wanting to look at. So this was me looking at it not only just in terms of physical activity, but we also know that it's equally important to be less sedentary. We've always heard the statement that sitting is the new smoking. And that, in fact, we really want to reduce our sitting behaviors just as much as we want to increase our moving behaviors. And so really looking at this from both sides of this activity. Excuse me. So what was new and what did I have access to? And I had access to 2 cool little new in technologies. One was this very, very high resolution CT, which is computed tomography imaging, which is the same technology that we use in the clinical setting, but this one takes really, really, really fine pictures of the bone. So it takes really super detailed, kind of the same thickness as a human hair. So we can get really fine details, but it doesn't just take pretty pictures, it measures them. So you can measure everything on this bone. And we also had access to a really interesting physical activity monitor. Linda's going to talk about more of these, but this was an accelerometer, and it was really essentially a little computer that you can wear on your arm. So it not only measures your motion in space, but it also measures a lot of your sweating and your temperature, body temperature. So it really does give us a 24-hour picture of what you're doing. So I was able to combine both of these technologies in my research and really look at, can this new technology from imaging look to see if we can detect really early differences in the hand bones in people with rheumatoid arthritis? And at the same time, can we identify if there's differences in their physical activity behaviors in people living with newly diagnosed rheumatoid arthritis? So in this study, we were able to recruit 30 people that were newly diagnosed with rheumatoid arthritis, so within the last year. And so then we were able to find them a study buddy, someone of the same age and gender, to go along this journey of this study with them. And so the people that we recruited were fairly typical of a typical person, if there is such a thing, living with rheumatoid arthritis. And that is, of course, the majority of them are women, somewhat later onset in terms of when they the symptoms first appeared. And as all of us, not just people living with rheumatoid arthritis, tended to be a little bit heavier in terms of their body mass index. So in terms of the RA participants, they were about 9 months out from the time of, or 8 or 9 months out from the time of diagnosis, and about a year out from the time they had their first initial symptoms with inflammatory arthritis. And they were actually really well controlled. They had really good early identification and significant disease management with DMARDs. So they were actually the ideal sort of early inflammatory arthritis patient from a research perspective, in that they were well controlled. So what did we do? So we looked at baseline, and then again at 6 months, and then at a year, we imaged their hand bone health using that high resolution imaging. And we measured their physical activities for 7 days. And then we also, because in research you always have to give lots of questionnaires and fill in lots of forms. So we did that as well. So in terms of just a little bit of detail of what we did for this imaging is we looked at the hand, and we looked at 3 different parts in the hand. We looked around the big knuckles, and that's kind of where the most common inflammation occurs in the hand. We looked right in the middle of the hand, sort of in the long bones of the hand. And then we also looked at the very end of the forearm bone, the place where you're most common, if you're going to fall, you're going to break a bone. And so this imaging allows us to look at, take out the different parts of the bone. So look at the hard outer shell of the bone as well as the inside of the bone, and take all sorts of really cool measurements. And really look at whether there's less bone, is it more dense, is it thinner, is it more porous, all sorts of interesting research exciting things. And then we also looked at being able to look at the behavior in terms of looking at what's the average behavior that you do in a day. So if you think in your day, so you're either, in terms of our looking at it, they either weren't wearing the monitor, so we didn't really know what they were doing. But the rest of the time, they're either not moving around, you're not moving around. And if you're not moving around, you're probably doing 2 things. You're probably either sleeping, or you're probably most likely sitting. Okay? And as you can see, we tend to spend a lot of our time doing those 2 activities in our day. Living with arthritis, or living in general, it's always a good thing to have some sleep. And so you can have altered sleep if you have arthritis, but it's also, you don't want to sit too much. And then we also spend part of our day just kind of going around, doing a little bit of stuff, moving a little bit, you know, brushing our teeth, moving our hair, preparing some light meals. So that's light activity. And then we can spend some of our day at slightly higher intensity activity that we call moderate activity. People think of that as exercise, that you have to be jogging and really, but what it really is just getting your heart rate up a little bit, you know, getting your body temperature up a little bit, and that's the health benefits that you get from activity. And we all know physical activity guidelines said you should spend, you know, a certain amount, 150 minutes in a week at this activity. Okay, and that you want to then ideally spend it in about periods of 10 minutes or more. Okay, so you want to spend some of your day in that intensity. So that's kind of how we can look at this from the research. So what did we find? So what we actually found, and surprisingly from my perspective, is we found quite profound differences in the hand bones in people living with rheumatoid arthritis. So the inside of the bone, sort of that spongy part of the bone, as well as the hard outer shell, were markedly different in terms of their microstructure. The bones were thinner, were more porous, there was fewer of these little trabeculi in there was more spaces, they were less dense, but it was not only in all three areas, so not only around the knuckles and in the hand and in the arm, but it was across all of these areas. But even more notably, it was the same whether you were 22 years old or 70 years old. So this was quite markedly different. And so what this finding showed that there's really early bone aging changes that are happening in early inflammatory arthritis, and that it's happening very, very early. And the other thing we found in terms of physical activity is that if you were living with this group that was living with early rheumatoid arthritis spent a little bit more than an hour and a half of their time being less active, spending at that higher moderate intensity of activity, which is not surprising. But what does that mean in terms of behavior? Well, it means that they were spending not only less time, an hour and a bit of less time up at that higher level, but they were spending it in less periods of time. So they were getting less time at 10 minutes or more in their day. That they were actually, when they were at they weren't even working as hard as their peers. And that translates to 3,000 less steps in a day. So that's quite a marked difference in their behavior. And in terms of what do we do in terms of their less activity, well, they were sleeping a little bit more at night. We didn't, I'm not talking about quality, but they were certainly spending more time sitting or lying around in their day, which again is not surprising. But if we can kind of look at this, we can help people walk through where in their day can they maybe look at changing some of their behaviors. And so they were getting a little bit more sleep, but equally importantly, they were sitting around 30 more minutes in a day. And so that has negative health consequences. And then if we looked at it a month later, my thoughts were that people with early arthritis might in fact start to improve and become a little bit more close to their healthy peers. But in fact, there was no change in either their bone health or their physical activity, which suggests that even though they had less activity and more bone health, that this wasn't changing. So there's lots of things that this might mean from a research perspective and all sorts of different questions. But from my perspective, really what we want to look at is what can you do? And then really what we want to do is be able to talk to your physician or your allied health professional about your bone health. Do you know what your fall fracture risk is? Do you know what your bone density is? Is it being monitored? And what is your vitamin D and calcium intake? And how active are you and how inactive are you? And how can we support you? So some of the other things is enjoy the outdoors and the sunshine, ideally with your family and friends. Think about twice daily things you can do for just 10 minutes or more. You don't have to be running, you just need to be moving. And you want to be standing up and moving around a little bit, about every half hour. And so the take-home message is, like everything else, just move around a little bit more and sit less. And this is going to help not only your joints, but your bones as well. So thank you very much.
Thank you, Dr. Feehan. Thank you, Dr. Feehan. So we do have a few minutes for questions, but we're going to ask you to stand to ask the question.
Yes. Excuse me.
Hi. I was wondering whether you entertained the idea that the changes in bone was occurring like before any arthritis activity. I mean, this could be something that happens in early life that leads to arthritis later on, as opposed to being a result of the disease diagnosis.
Well, actually, yes, I think that is that the bone changes don't happen that quickly. So within 8 months, even the bone doesn't change, it can't happen. So in fact, it suggests that these changes are happening very early, before the joint symptoms are occurring, the inflammation is occurring. But we know in inflammatory arthritis and all inflammatory arthritis, there is that sort of preclinical phase where things are happening underlying before these joint symptoms occur. So the feeling is that sort of that trigger, that early preclinical is when these bone changes are actually happening before the joint symptoms are occurring, along with some of the other changes that some of the heart changes that might be happening. And so the positive spin I would take from it, though, is not only is it happening early, but once they got started, these patients got started on their inflammatory arthritis management medications, they didn't get any better, but relatively they didn't also get worse. So that suggests to me that I don't know if they're going to improve their bone health as management, but at least it suggests that over time they're not getting worse. We didn't look at long term, so I can't say that for sure. So we do need to look at this earlier and take it more seriously, yes.
Is there another question?
Here?
Getting up is not easy.
Yeah.
Okay, as a fibromyalgia patient, victim, whatever, is there a correlation between arthritis and fibro? Do you know?
That is a question, as a physiotherapist, I'm really not 100% sure about in terms of the bone health piece, but I would say that most definitely in terms of the physical activity piece is that I think a lot of what the limited activity and mobility in people living with any form of arthritis or sort of chronic pain is the fatigue and the sort of the ongoing joint pain or limitation to be less active, and the need to be resting a little bit more to recover. So I would say from a physical activity perspective that yes, there would be some relationship, and that has impact on your bone health as well as your joint. I don't know in terms of whether it's impacting your bone health.
Because everybody that I know that has fibro has arthritis.
Yeah.
And that's why I was wondering if there was...
And that's a question I'm not an expert in that area, so I'm sorry I can't answer that directly.
Thank you, Dr. Feehan.